Hi, hello, and welcome to my channel. My name is Lethukwenama, and I'm bringing you yet more exciting content. So, if you've already subscribed, I truly appreciate you. Please keep watching, and if you haven't done so, please subscribe down below. Coronavirus. When I'm shooting this video, we are sitting at 116 cases in South Africa. That's 116 cases of coronavirus, confirmed cases. When I went to bed last night, we had 85 cases reported by the Minister of Health. So 2 weeks ago, I was okay. I was fine with this. I said, you know what? South Africa, we've had many challenges and coronavirus won't exactly be one of them. Even if we have those 10 cases, we will be able to manage them, control them. We're really not having an outbreak. Fast track, a few days later, here we are at 116. So I really hope that it hasn't taken you as long as it has me to realize how serious this issue is. We really need to be taking this seriously and taking the necessary measures to make sure that you are not part of the spread of this virus. So if you are in university right now, you know that the Minister, Dr. Lethukwenama of Higher Education, announced that all colleges, university, technicons, they're all closing and will be opening mid-April. And that's the communication we also got from our university. So the most uncomfortable thing right now is that no one knows. Yes, we say mid-April schools, universities and colleges are opening, but we really don't know. We are very uncertain, and that's the space that I'm in. I don't know what's going to happen. So because I'm doing like a rural clinical school program for my final year, I'm in a very small town, so I'm not actually at the main university campus or the medical campus. I'm elsewhere in a very small town in the Western Cape. So I had the option of actually, staying where I am because I live in a house and not a residence with a lot of people. And then actually maybe working or carrying on with my academic work. But also I don't want to be stuck here and not be able to go home because I actually don't know what the outcome of this whole pandemic is going to be. And I think that's the thing. We're making a lot of decisions right now, and that's good. But we really don't know what it's going to be. We're trying to be able to get control of it in South Africa, but that's only if everyone plays their part. That's literally only if everyone plays their part. I don't want to be stuck in Sirius and not be able to go back home in KZN, which is plus minus 20 hours away from here. Which is, I think, is an issue that a lot of students are facing. And also, you don't know whether you've been exposed or not. Especially people who are at universities where they've been confirmed cases. How do you know whether you have been exposed or not? And now that you're going home, how do you know you're not a vector going to expose other people where there wasn't any confirmed cases of the virus before? So that's the risky thing now with a lot of university students flooding their hometowns. So that's something to be wary about. So if you are that student, just be wary. Make sure you're definitely taking all the necessary precautions and make sure that your family and your community is safe. This is for the healthcare workers. Sure, guys, I think it's very different for us medical students, especially being in final year now. We have the option of actually going home and not, being in hospitals. But you guys don't. This is your job. This is what you chose, and this is where you are now. And thank you so much for the work you're doing. Thank you so much for your sacrifices. I think everyone has always said that medicine is a hard job. You can't do it for the money. You can't do it for the status. It really has to come from in here. So now you're literally exposed to this virus and you have to work in that space and treat those patients. So thank you so much. And one of my other concerns is just children that depend on, I made a post about this actually, a lot of students that depend on the feeding schemes at schools. So now that schools are closed, what's going to happen to those children? So for the people that are hoarding and stockpiling, that is very unnecessary. That is selfish and inhumane, really. You need to do better. You don't need 10,000 rolls of toilet paper. You don't need to buy 3 trolleys and fill up your fridges 3 times more than you should. No. I think what's very important and what a lot of us aren't getting in this time is that we need to be community centered. You know, we need to be able to not think only about yourself and about your family, but also the people around you and how this thing is going to affect them. We don't know where we're going to be in 2 months' time. You know, one of the media sources predicted that South Africa might be at 70,000 cases by the end of March, at the rate at which we're going. You know, a friend of mine said she was walking around Joburg and no, she was driving around Joburg. Sorry, I take that back. And the gyms were full. People were full on exercising in overcrowded spaces. And the restaurants were buzzing. We really need to do better. And Joburg is one of the provinces with the highest number of COVID-19 confirmed cases. So they really need to do better. People in Joburg, do better. People across all provinces. I know there are some provinces that haven't had confirmed cases of coronavirus. Sure, guys, that's good. Keep it that way. Keep it that way. So a post that I read this morning said, fast track to 3 weeks time. You wake up one morning, you're coughing, you have a fever, and your body is sore. You go get tested and you test positive for coronavirus. All right, you recover. But now coronavirus, we know, has an incubation period of about 2 weeks. So imagine all the people you've been in touch with for 2 weeks. The people that you might have infected. People who aren't as strong as you, who aren't as young as you and I, who aren't as healthy and able-bodied. And those people are now infected with this virus because of your recklessness. If obviously you didn't take the necessary precautions. So now it's really bigger than you. It's bigger than me. It's bigger than the healthcare system. And that's why everyone needs to be playing their role. So now imagine you've exposed someone you didn't know they were HIV positive, they had TB, they had some form of cancer, and they're obviously immunocompromised, these people. And getting a virus like this really will take a knock at their health. So you don't want to be that person. So we really all need to be playing our role. I hope I haven't touched my face during this thing. Do not touch your face. Don't touch your face. Do not touch your face. Clean your hands. Yes, sanitizer works, but apparently some people have finished sanitizer off the shelves. So soap and water works too. Soap and water, wash your hands. That really works, you know. And a community like mine, we don't have water all the time. I mean, some communities don't have water at all. So I know I'm going home tomorrow, and I'm going home to a place where we only have water for 2 days. It's off for another 2 days, and then 2 days again, or maybe 1.5 days. It's really unreliable. So fill up your tanks, fill up your buckets, fill up your everything that you have, honestly, to fill up water, and make sure that you're keeping clean and you're keeping your family clean. And the government, I really hope that everything that's happening right now, everything that's revealed, nothing that's new really, is an awakening for the amount of work that we need to do as a country, for the things that we're supposed to be prioritizing. I saw a very funny meme. I think some of you have read it already. So it's a meme of, I think, a biologist, and she's saying that you pay soccer players 1 million euros, but you pay a scientist or a biologist researcher 1,800 euros, and now you want a cure for coronavirus. Go ask the soccer player. You know, I mean, I thought it was funny because it just shows us what we have historically prioritized as a nation, you know, and how much we've undervalued people who actually make a really great difference in our society. Not undervaluing the things that some soccer players do, definitely props to you, but this is also an awakening call to say, what are we doing as a country? What do we find is important, you know, and what are we investing our money into, and how is that going to empower our communities and South Africans as a nation? So to President Ramaphosa, to Dr. Zweli Mkhize, thank you guys for all the work that you and your teams have been doing. It's been great so far. I really hope that we go stronger forward, and everyone, South Africans, we need to be playing our roles. I think we actually had an advantage compared to other countries right now. We can still control this. We can still contain it. We really don't need to get to 200 cases. We are at a good stage compared to many countries right now. And you and I can make a difference. Let's say we look back 5-6 months from now, 10 years, 5 years from now. Make sure that you have a good story to tell about your role in this pandemic. Make sure that you know that you are an active change agent, as Stella much likes to say. Make sure that you're an advocate for health and that you made a difference in making sure that you are safe, your family is safe, and your community is safe. Thank you so much for watching. Subscribe and let me know what you think. It's quarantine time. So what are you going to be doing during this time? I know I'll be reading, I'll be diarizing, I'll be definitely catching up on my mate's schoolwork and studying for exams. What are you going to do? Are you playing games? Are you studying? Do you have exciting playlists that we can listen to? And yeah, just let me know what you're going to be getting up to and what measures you have taken to make sure that you're contributing positively to this pandemic. Thank you so much. Goodbye.